Executive Vice Dean in medical school. I came here in July of 1989 to start residency in medicine, and have never found my way out of town. And that was a very conscious decision, just to go to Rachel's, whether that was first part or second part.
That's
part of Rachel's question. I have found this to be an extraordinary place. I heard a little bit of Ted's comments and just tag on to some of what he said. The thing that makes it so is you all. And our colleagues across the School of Medicine, whether that's the faculty, whether that's the learners and the trainees, or that's the staff. My sampling has been that people come here to be a part of something special and a place where mission matters. I'm sure many of you have come from great places, and so I'm not trying to cast aspersions. What I hear from a lot of people who come here is that it's just different. That it matters differently, and that people understand the connectedness of the mission across all three parts differently, and that is very special for me. And so it's been a great privilege to be able to be here and be in various roles, and mostly to engage with this community. And so, welcome. We're thrilled that you're here. We need you, and we look forward to working together.
Good morning, all. I'm Anthony Rosen. I'm the Vice Dean for Research at the School of Medicine. I arrived in July 1990, 1 year after Landon, as an intern in medicine, and I've never left. Not that I didn't look at other opportunities over the years. In the 35 years or so since I arrived, I have seriously looked at, 3 or 4 opportunities. And each time I decided to stay. And that tells you something about the institution. There's something about this place that has this very kind of unique, collegial set of interactions. And the ability to really ask questions about human disease is really exceptional here. The only other thing I'll add is that when I first arrived, like what is special about the place, when I first arrived, on faculty at least, within a few months, it was like, the people were too nice. I'd done my postdoc at Rockefeller in New York, which is kind of a little aggressive. And when I came here, I was like, sure, man, these people really are going to do something dishonest. They want my ideas. I was incredibly suspicious. And when I realized after just a few months was that, in fact, it isn't that incredibly collegial, generous place. So that hasn't changed. So welcome to you all. I'm sure you're going to have a wonderful time. You have to push it.
Push this button.
Push this button here.
Oh, thank you. See, collegiality in action. Hi, my name is Redonda Miller. I am a general internist, and I currently serve as president of the Johns Hopkins Hospital across the street. I have been here 38 years, since 1988, but I came as a medical student. So even though I came before these two guys, I started earlier. So no indictment of age here. We won't do any age comparisons, but we're the same genre. Why I decided to stay at Hopkins really fits with what I wish I had known when I started, and that is to echo what these two said. The collaborative feel. It really is the people, your colleagues, this sense of team, the collaborative nature of whatever you want to do, which brings me to the point of why I stayed and what I wish I knew. Is that I wish I had known that whatever it is you set out to do, there's a team here that's willing to help you and be a part of it. I thought it was every man for himself. You hear these rumors, oh, it's a competitive place, and that is actually not true. And I can give tons of examples where, okay, you want to do this, and pretty soon there's an entire team who wants to help you and be a part of that work to move it forward. So I've stayed because of the people. Welcome to you all.
Good morning, everyone. My name is Peter Espinjade. I'm the interim vice dean for education, and before that role, I'm the associate dean for graduate biomedical education, which is what the role oversees our master's and PhD programs. came here 23 years ago as an assistant professor in the cell biology department and have stayed for all the reasons that everybody mentioned here. It's a pleasure to welcome you. I thought I'd take the other question, which was something that I wish that I knew when I was in your position, and that is that each one of you matters and that your voice and your opinion matters. So you heard from the dean that this is a large organization on its, just in terms of scale, but it's small in terms of how many layers exist between you and leadership. So if you have a question, a concern, a problem, just elevate it. You can always email me if it's an education question. I'm happy to help. But that's something that's not really clear, I think, when you're first here.
Wonderful. Thank you all so much. We want to shift a little bit and really speak to the current moment. I think the dean alluded to this, that you are all joining academic medicine at a somewhat challenging time because of the environment that we're in. And we would really love for you to speak to important changes or challenges that you feel are in process or coming, and how your team is dealing with this and what new faculty should be aware of.
So I did not get to hear all of Ted's comments, so I apologize if this is entirely redundant. So it's pretty clear there's a lot of stuff going on, right? And that the nature of that is such that it has the potential to threaten some of the things that we have historically been able to do. What I would say at the top is that throughout really, really intensive work by our entire community in planning since February the 7th, which was the day the NIH announced that indirect cost rates, which we could talk about at a different time, are going to drop significantly, which would translate into a substantial loss of revenue for us. From that date forward, our colleagues have been rallying around planning to position us to be able to sustain our commitment to all the parts of our mission. So there's not been a moment where there's been any ambiguity or any wavering from our commitment to education, to research, to clinical care. There's also been a very, I think, pretty clear-eyed, I hope, recognition that in the face of the kinds of things that could be coming in terms of predominantly revenue threats to us, that we're going to have to be able to think differently about how we sustain that mission and how we make determinations about what we do with resources in order to be able to execute on all three parts of the mission. And the second piece of that is that we have, over the course of the last number of years now, really made substantial strides in improving faculty compensation. Really substantial. And while in the moment we have had to put a pause on that, we have also not backed away from our commitment to making sure that we are addressing faculty compensation as what for the last 2 years the dean has said is the top priority in school medicine. So I would just offer those up as a couple of points anyway in the current climate of things that we are thinking about, having to plan with and for as we contemplate how we're going to go forward, and that it really hasn't impacted or diminished our commitment to mission or to our people.
Okay, well, we sometimes compete in the dean's office as to who has the worst job at the moment. And I often have the worst job. But let me say a couple of things. The reason is because I think the overall kind of message that comes out of the current administration is one which is very threatening to the way that we've always done things. And from the point of view of individual faculty, there is this tendency to be and feel threatened by that. So my first piece of advice is don't be threatened by it. Right? Leave that threat to the macroeconomic things that are happening at the highest levels of the institution, you don't have to worry about the macroeconomic things. You have to worry about the stuff that really affects you. So that's comment one. Comment two is that when we look around, people will variably acknowledge that they feel fearful about what's coming. What is this profession going to be in a few years' time? What is the funding environment going to be in a few years' time? Is this going to be sustainable in a few years' time? And I will note a couple things that we individually we're all different in terms of how fearful we feel in response to whatever threat is out there. Some of us, including me, right, are on the catastrophizing part of the spectrum. And I'm known as catastrophizer in chief, but it's good to be a catastrophizer because you can see what the problems are that are going to come, and you can deal with them ahead of time. So there's this famous Nelson Mandela quote about fear, which is that courage is not the absence of fear, right? It's the triumph over it. So my second piece of advice is that the reality is we all are going to feel somewhat fearful in the next while because the environment has uncertainty, cannot see the future, okay? And therefore, I think I've just got to focus on the fact what you can do well. And the things that you came here for, you will be able to do well. You'll be able to do amazing clinical care. You will be able to do amazing discovery. You'll be able to use the new exceptional tools of the era, measurement tools, data analysis tools, computational tools in ways that are going to change the way that medicine is understood, that science is understood in practice. Right? From your point of view, focus only on that opportunity of the future, and all this other stuff will, like McCarthyism, be remembered in history.
Maybe I'll just take a minute and talk a little bit on the health delivery side of some of the challenges we're worried about. I know not all of you will be seeing patients, but for those of you who will, on the hospital health system side, at the federal level, we worry about Medicaid reductions and what that means for patients and what that means for their access to care. So we at GHH have never, ever, ever turned away anyone, nor will we ever turn away. We give away charity care all day long. But you just wonder about people being reticent to seek care. We worry about the 340B program. I won't go into detail. It's a savings program, a drug savings program that allows all hospitals that meet a certain threshold for delivering charity care to purchase drugs at a discount. And so we worry if that program goes away, what that will mean for our financial health. Dropping down to the state level, Maryland is hospitals in Maryland are paid very differently than the other 49 states. We have global budgeted revenue where you're given your revenue a year in advance, and it doesn't matter if your volume goes up or down, that is your revenue. And there are pros and cons to that payment model. It is up for renegotiation right now. It is a model, it's a contract between the state and the federal government. Hospitals give input, but we are not parties to the contract. So we worry about those negotiations and how they'll go forward. On the local level, at the hospital, we worry about capacity. We have patients that are dying to receive care here. They're in our EDs. They want to come to us from our Hopkins access line from around the region, and we need more beds in ORs. So we worry about capacity. And then the final thing I'll mention locally is we worry about the School of Medicine. All the challenges that you have heard are important to the hospital. And we work incredibly well together, hospital, health system, School of Medicine, university. And when one boat rises, all boats rise. So we worry every day about the challenges right now facing the school.
Thank you. So as I mentioned, I have the pleasure of representing education and as the interim vice dean, and it's one of the core missions, one of our 3 core missions at the School of Medicine. And I assume that all of you came here and want to be part of an academic medical center because of the unique opportunities that are provided in education, whether it's in the clinic with residents and fellows, or medical students, or in the classroom, or in the laboratory with master's, PhD students, and postdocs. And so some of the things that I think about is as these pressures mount on the research enterprise and on the clinical enterprise, that people's time to spend on education and in that endeavor and supporting these trainees will sort of be squeezed out a bit. So I would encourage all of you to seek out, embrace as it's appropriate. For those of you who don't want to overcommit necessarily in certain areas, but I am concerned that as these other pressures mount, that people will pull back from that. So I encourage you to lean in rather.
Thank you.
And but I'm just going to add it too. I didn't mean to leave everyone with this depressing type picture. We've worried about 340B and Medicaid payment for the last 3 decades. And so I am confident that solutions will be worked out. We've been through these kinds of challenges on the healthcare delivery side before, and I'm confident that we will figure it out and be fine.
Great, thanks. So I'm going to ask another question to the panel, and then we're going to open it up to the audience to ask 1 or 2 questions. So if you have a question in mind, hold on to that. And I'm going to give the panel a choice. I'm going to ask everyone to respond. So what I would love to ask you to speak to is either, the first question could be, and you can choose, is what's one specific ask that you have for faculty as you consider how they can contribute to the Johns Hopkins School of Medicine mission? And so I want you to kind of speak directly to our new faculty here. Or, as a leader, what is one Hopkins program or initiative that you think many faculty don't know about but should?
Okay. So I think on the research side, probably one of the most important asks is to keep putting grants in. Okay? And the reason I say that is because if you don't play, you cannot win. That's number one. Number 2 is that even though things may be somewhat unpredictable at the moment, the School of Medicine in the last academic financial year, in spite of all of the tremendous pressures, on the research side, we actually started with this pretty big buffer. And as the year became more and more intense, that buffer whittled away, and we never reached what we budgeted. But we didn't miss the budget by hundreds of millions of dollars. We missed the budget by tens of millions of dollars. As Ted mentioned, we're talking about more than $1 billion a year of research awards. So tens of millions of dollars in the setting of what we had wasn't bad. The key now is to keep on applying, right? And the way that you are going to be successful as faculty is for you to find great partners, helpers, advisors. Do not go it alone. So keep putting grants in and do not go it alone. Like, let other people look at your grants before you go in. Let them advise you about this is going to be terrible or it's going to be great. Even though we hate hearing the terrible part, better that you hear it from your friends than from the study section. So those are my 2 pieces of advice.
I'm just going to take a little liberty. In one sentence, what I would love for you to do is work across departmental silos. I think it is so important, and we can achieve so much more if all the departments work together and not just sort of entrench and say, well, this is what we do in surgery, or this is what we do in biochemistry, or this is what we do in pediatrics, but forging those relationships across departments. The one thing I want you to know about is we, Johns Hopkins Medicine, do a ton for the community, and we're very proud of that. Last year, the hospital community benefit totaled $360 million back to the university. We have fantastic programs, everything from small back-to-school events to impactful initiatives like purposefully hiring local residents who are returning from prison and can't get a job. everything from local cleanups to providing housing for folks who need a stable living environment. So I just want you to have a sense of pride that we are giving back to the community in a meaningful way.
So I try to make a little pitch for education. I'll reiterate that for all of you who have the title of professor, that if you do hold that title, one of the things that we should be doing is teaching and professing. So I'll make that pitch. In terms of a program or resource, it's more of a resource, but the university has just stood up this incredible thing called AI Lab, which is an internal collection of software resources that allow you to work on your data, work on your projects without exposing that proprietary material to any outside organization. So I would really encourage you all to investigate those different tools, take any training that's involved, and so that's the one thing, AI Lab.
I would pick up a little bit on Radonda's comment and say, I'm going to offer a couple of things maybe. So one is that while you will be working hard, focused on whatever it is, whatever drives you, please remember that our strength as Johns Hopkins very much is based on the fact that we work as a community across all three parts of our mission, and keep that very forward in your consciousness, regardless of what it is that you focus on. There is just no question in my mind, and I think anybody's mind, that is where our strength is, and that is distinguishing compared to the way that lives in lots of other places. The interdependence and the synergy between all of the parts of the mission is incredibly important to us. And so we work really hard to try to sustain all three parts of the mission and not just say, yeah, Peter's a good guy, he works really hard, education matters some, but we're just kind of scrubbing that this year. We're going to focus on the other parts. That's not at all how this lives. We ask that you all be cognizant of that. And then also to pick up, this is, John, everybody's comments, this is an incredibly easy place to engage with. Maybe not around all our processes, but with our people. The community is incredibly easy to engage with, and I promise you, your colleagues have a very low threshold for wanting to help you, as you've heard from others. So please have a low threshold to reach out and engage with the folks in our community. It'll make a big difference in terms of, I think, how you experience the place, the opportunities that will present themselves for you and that you will take advantage of, and how you are able to succeed with it. So we're really happy that you're here, and we want to help. As Peter said at the top, there's just not that many layers between wherever you are in whatever group and any of us or any of the other leadership. And so if you're not able to get the support you need, or you're confused about that, just email one of us or talk to the division or department director in your own camp. So with that, again, thank you all for being here.
Thank you. So I'm going to invite a question from the audience. I think we have time for just one, but I really want to amplify what you just heard. These folks are really accessible. All of us in the Office of Faculty reach out anytime, but really when you hear this group of people here in front of you saying reach out, email us, ask your questions, ask for help, ask for advice, they really mean it. Okay, is there a question from the audience? Anyone? Yeah, how about here? Anna.
Hi. My question, I think, is mostly directed at Dr. Miller. You had mentioned community programs that Hopkins is involved in. I'm wondering if there's a central hub for us to look at so that we are not reinventing the wheel when we have ideas of how to integrate.
Before she answers, can you say your name and your department, please?
Yeah. My name is Anna Reed. I'm in pediatric gastroenterology.
Thank you.
You bring up a great point. The question had to do with, is there a central hub that sort of unifies our community work if someone wanted to get involved? And I would say we could be better. There are certainly initiatives on the hospital side, initiatives in the school side, in the Division of General Internal Medicine. There's lots of good work going on in the community. One go-to resource that I tend to go to is our Office of Community Affairs, because it spans hospital, health system, and university. And they are a font of knowledge, and I can connect you to some people there if you like. And they're more on the delivery of benefit to the community. there is a ton going on in research on how we help people who are underserved in our local community. And I'm not the perfect person to speak to on that, but I'm sure Anthony or someone could get you information.
Great. Thank you so much. I think with that, so we can stay on time, we'll wrap it up here, and I want to ask if we can just thank our panel so much for being here. So good job.